Namaste. I am Dr. Neetu Esjit, Director and Consultant Physician at Dr. K.V. Vijayan Institute of Ayurveda Medical Science Private Limited. It's my privilege to welcome you to our webinar, Confronting the Parkinson's Pandemic, Exploring the Safe and the Promising Role of Ayurveda. We are deeply honored to be joined today by individuals living with Parkinson's, caregivers, healthcare professionals, and those committed to learning more about this condition. Your presence is truly valued, and we sincerely thank you for taking this time to join us. As we observe World Parkinson's Day and Parkinson's Disease Awareness Month, our objective is to raise awareness and provide education about Parkinson's disease. We are dedicating to advocating for better access to care and the development of innovative, integrative treatment approaches. Together, we strive for a future free from the burden of this functionally impairing disorder. Thank you. Thank you once again for your participation. We look forward to an engaging and insightful discussion. Before introducing our esteemed speaker, I would like to say a few words about VIAMS. Dr. K.V. Vijayan Institute of Ayurveda Medical Science Private Limited is a traditional, authentic, and legacy Ayurveda enterprise with a rich history spanning 4 generations. We specialize in treating neurological conditions, particularly Parkinson's disease, as well as infertility, women wellness, spine and joint care, and lifestyle disorders. Our integrated treatment protocol combines Ayurvedic science with physiotherapy, psychology, audiology, speech therapy, dietetics, yoga, and meditation. Every treatment at VIAMS is personalized, ensuring that care is not only effective but also deeply aligned with each patient's individual needs. This customized approach is at the heart of our continued success in delivering exceptional healthcare. Ladies and gentlemen, it's our pleasure to introduce our esteemed speaker, Dr. Vijit KV, for today's webinar. Dr. Vijit KV, Chief Physician and Managing Director at VIAMS, and a leading expert in Ayurveda, neurology, and wellness. Hailing from the distinguished traditional Ayurveda family, Palladath Dr. Vijit is a highly respected Ayurveda neurologist with vast experience in diagnosing and managing neurodegenerative disorders, including Parkinson's disease, movement disorders, Alzheimer's, and more. With a deep commitment to advancing care and support for individuals affected by Parkinson's, Dr. Vijit brings invaluable knowledge and insight to this session. We invite you to engage throughout the webinar by submitting your questions via the chat box. Let's all extend a warm virtual welcome to Dr. Vijit KV.
Thank you, Dr. Neetu, for the wonderful introduction. Good evening, everyone, and warm greetings on this World Parkinson's Day. Today, we come together to shine a light on one of the fastest growing neurological disorders of our time, Parkinson's disease. Affecting over 10 million people globally, Parkinson's brings with a range of motor and non-motor challenges that can deeply impact quality of life. Unfortunately, despite advances in modern medicine, a complete cure remains mysterious. Current treatments are largely symptomatic with significant side effects over time. This is where Ayurveda offers a beacon of hope. At VIAMS, we have spent over 12 years researching and developing a comprehensive Ayurvedic protocol for managing Parkinson's disease based on classical texts, modern neurological insights, and our extensive clinical experience. One of our most exciting frontier has been incorporating gut health into Parkinson's care. Ayurveda has always emphasized digestion, that is Agni, and now the modern science too acknowledges the gut-brain connection. Through digestive enhancing herbs and microbiome supporting therapies, we are witnessing improved systemic outcomes. Over the years, we have treated thousands of patients across different stages of Parkinson's. Many have shown remarkable improvement, better movement, speech, sleep, and even reduced dependency on allopathic medications under guidance. Let us move forward from illness to wellness with Ayurveda, not just as a tradition, but as a scientifically grounded, compassionate model of care for the future. Now, I would like to move to my short presentation. So, what is Parkinson's disease? Parkinson's disease is a progressive neurodegenerative disorder of the central nervous system, mainly affecting the movements. So, progressive neurodegenerative disorder primarily affecting dopaminergic neurons in the substantia nigra, which is a part in the brain. This leads to develop motor symptoms like tremors, rigidity, bradykinesia, and non-motor symptoms like cognitive decline, mood disorders, and sleep disturbances. Parkinson's disease affects millions worldwide and currently no cure. We can correlate Parkinson's disease to Kambavada in Ayurveda. According to Ayurveda, the human body is composed of various elements and energies that interact to maintain health and well-being. Ayurveda describes the body as a miniature of the universe with its own unique constitution and balance of energies. The fundamental principles of Ayurveda revolve around the concept of five elements: space, air, fire, water, and earth, the Pancha Mahabhutas. These elements combine to form the three doshas, or the biological energies known as Vata, Pitta, and Kapha. So each dosha represents a combination of two elements and governs different physiological functions of the body. Vada is the entity concerned mainly with the control and coordination of our body by maintaining all kinds of movements and thought processes. Aggravation of certain qualities of Vada represents as tremors, imbalance, cognitive impairment, etc. Thus correlate Parkinson's disease to such an exaggerated condition of Vada called Kambavada. Let us see how Kambavada is explained in Ayurveda classical text. Karapada tale kambe deha brahmana dukkide nidrabango madikshina kambavadasya lakshanam. This is mentioned in Basavarajiam text in the 6th chapter, which means shivering of the palm and soul, vertigo, severe grief, loss of sleep, reduced confidence are the symptoms of Kambavada. Well, Parkinson's disease occurs due to degeneration of dopamine producing nerve cells in a specific region of the brain called the substantia nigra. Dopamine is a neurotransmitter that plays a crucial role in regulating movement and coordination. The decline in dopamine levels leads to the hallmark symptoms of Parkinson's disease, including tremor, rigidity, akinesia, and postural instability. Shall I ask you one thing? Are we at risk? Certainly not, but yes. Do you know approximately 1% of the people above 60 years of the age suffer from Parkinson's disease globally? And recent observations shows a growing number of younger people, that means younger than 50 years of age, are being diagnosed with PD, which comes around 8 million of global population, even though we can control Parkinson's disease. The Nidanas, that means the causes of Kambavada, mentioned as per Ayurveda classics are affecting Uttamanga, that is Abhyandara Marma Abhigada. Second is Mithya Ahara Viharas, improper food habits and lifestyle habits. Concept of dushi visha, that is pesticides, preservatives, coloring agents, and drugs. The last is Janapadodvamsa, pandemic or epidemic diseases, role of pollution, air, water, or soil. See, we had overcome a COVID situation for last 2 to 3 years of time. You may have catch up the caption of this webinar with Parkinson's pandemic. Yes, it is a high pandemic time because even after the COVID, people with 30 years of age, 40 years of age are diagnosed as Parkinson's disease symptomatically. But if we go for an imaging of the brain, there is no structural damage. Not only Parkinson's disease, different types of neurological disorder. So that's why I mentioned the word pandemic in the caption itself. Some of the common causes of the neurological disorders including the Parkinson's disease are mainly one of the thing is modern lifestyles. In today's lifestyle, it is very stressful world. Our modern lifestyle can harm neurological health. Factors such as chronic stress, sedentary behavior, unhealthy dietary habits, and exposure to environmental pollutants can increase the risk of neurological disorders. Genetic factors, yes, some neurological disorders have genetic component. Faulty genes can increase susceptibility to conditions like Parkinson's disease. Genetic predispositions can also interact with environmental factors to trigger the onset of neurological disorders. The most important one, medication side effects. Certain medications, particularly those used for treating chronic conditions, may have neurological, not may, might have neurological side effects. These can range from symptoms like headache to dizziness to more severe effects such as cognitive impairment or movement disorders. The next is head injuries. Traumatic brain injuries resulting from road traffic accidents or any such accidents or sports related incidents can cause various neurological problems. Internal head injuries like mild stroke even in the sleep or a bleed may lead to Parkinson's disease after a particular age, and those types of Parkinson are known as vascular Parkinsonism or vascular Parkinson's disease. The next is hormonal imbalances. Hormonal disorders such as thyroid dysfunction or hormonal fluctuations during menopause can impact neurological health. Hormonal imbalances can affect neurotransmitter levels, disrupt neural communication, and contribute to symptoms like mood swings, cognitive difficulties, or memory problems, which will lead to Parkinson's disease. Now, let's look into signs and symptoms of Parkinson's disease. We can classify it into motor symptoms, those related to any movements in the body, and non-motor symptoms, that is the cognitive, that is those related to conscious intellectual activity such as thinking, remembering, or reasoning, and sensory will also come under non-motor symptom, that is related to sensation, conveying nerve impulses from the sense organs to nerve centers. Let us go detail in the motor symptoms of Parkinson's disease. So the cardinal symptoms of Parkinson's disease, that is tremor, rigidity, akinesia, and postural instability. Tremor, there are different types of tremor: rest tremor, kinetic tremor, pill rolling tremor, and essential tremors. Next is rigidity or the stiffness. The elasticity of the muscles become reduced is known as rigidity or the stiffness. Akinesia means loss of ability to move the muscles voluntarily, and bradykinesia means the slowness of the movement. Postural instability means the patient may not have the proper alignment of the body parts, which may affect the performance of the work. You may see that the People with Parkinson's disease will bend their shoulder to front and the hands will be very stiff. That is the postural instability. And the other symptoms of the motor symptoms are micrographia, that is the handwriting, smaller handwriting, masked face, no expression in the mask, dystonic movement, that is abnormal muscle movements, fascinating gait, dysphagia, difficulty to swallow, dysarthria, difficulty or unclear articulation of the speech, monotonous soft sound like that only. Then absence of arm swing while walking, drooling, that is excessive salivation, and a lot of symptoms like aches, pain in the body, muscle cramps, dressing difficulties, slipped chapels, bed rolling difficulties. These are all comes under motor symptoms. Coming to the cognitive symptoms, mainly includes depression, that's a mood disorder, as we all know. Anxiety, that's anxiety is a normal and often healthy emotion. Apathy, that is lack of interest. Psychosis, that is a disorder characterized by thinking and emotions that indicate the person experiencing them as lost contact with reality. Next is the emotions, a strong feeling deriving from one's circumstances, mood, or relationships with others. Other cognitive symptoms include sleep disturbances, REM, sleep behavior disorders like insomnia, daytime drowsiness, fearful dreams, hallucination, loud noises during the sleep, confusions, depression. These are all the other cognitive symptoms we generally see in Parkinson's disease. And now coming to the sensory symptoms, there is the panchendriyas. In most of the cases where the brain has trouble receiving and responding to information that comes in through the senses, which comes under sensory symptoms, are mostly affected to sight, diplopia, that is the double vision. Second is delusion, that is the imaginary vision. Coming to the hearing, it is tinnitus or ear imbalance, vertigo. Coming to the smell, imaginary smell or anosmia, that is a complete loss of the smell, and hyposmia, reduced ability of the smell. When it comes to the touch, pain and pressure sensitivity and abnormal sensation all over the body. Coming to the taste, impaired taste means that the PD patient's sense of taste is not functioning properly. Hypogeusia, that is reduced ability of taste. Then overall other symptoms like urinary incontinence, hypotension, sexual problems, constipation. Constipation is the very primary symptom seen in a Parkinson's disease patient. Severe fatigue, frequent falls, bruxism. These are all comes under other symptoms of Parkinson's disease. Now, what are our objectives in treating this Parkinson's disease Ayurvedically or naturally? Our main objective is to halt further degeneration. As we all know, this is a progressive degenerative disorder. So halting of further degeneration is the main important point in our objective. The second is betterment of quality of life of the patient. The third is longevity with better health and maximum lifespan, and regeneration of cells in possible cases. I repeat, in possible cases only. It is hardly difficult to regenerate the brain cells, but it will be least possible in some cases. Then improvisation in social living, and the most important, reducing the side effect of the medicines. Why I stressing the reducing side effect of the medicines is the intake of artificial dopaminergic drugs causes degradation of natural dopamine production. So long-term dopaminergic medicines may cause dyskinesia, that is a dystonic movement, that is abnormal muscle movement. And if the patient didn't take the dosage, the body will be completely freezed. And the psychiatric medicines, mainly beta blockers, can cause drowsiness. What should be our approach towards a Parkinson's disease or a Parkinson's disease patient? With the support of the Ayurvedic treatments, we aim to slow or stop the progression of the Parkinson's disease by protecting the brain cells from further degeneration. betterment of quality of life through our integrative treatment protocol that restores balance, improves function, and supports overall well-being. Experience longevity through expert guided care and minimal side effect treatments tailored for sustained well-being. Then our uniqueness or our unique what set us apart from others. The first point is the authenticity in medicines. We are privileged to have a GMP and ISO certified medicine manufacturing unit, which enables us to make customized herbal combinations as per each patient's requirement. Next is the personalized customization in therapies. Therapies are molded to suit each patient and ailments. Integration at our institute, traditional and personalized Ayurvedic treatment is incorporated with allied healthcare sciences like physiotherapy, psychology counseling, ASLP, audio speech linguistic pathology known as speech therapy, then yoga, dietetics, occupational therapy, etc. Then faultless approach. We keep a 360-degree focus on the patients and their symptoms, by which we can also manage all related conditions. And our legacy, a rich and splendid healthcare tradition spanning 4 generations. Now, coming to another important point, what are the investigations available for Parkinson's disease? Honestly speaking, the best investigation method is the interaction between the doctor and the patient. Anyway, the available laboratory investigation includes CT scan, then MRI scan. Definitely, the MRI scan offers detailed images of brain tissues that is useful in identifying early neurodegeneration, vascular changes, and differentiating Parkinson's disease from atypical Parkinsonian syndromes, which is very important in the treatment of Parkinson's disease. The next coming is the PET scan, a highly sensitive tool that detects dopaminergic deflects by visualizing dopamine transporter activity in the brain. That is mainly often used for early or unclear diagnosis. Next is levodopa drug challenge test, that is a TRODAT scan. Helps confirm Parkinson's disease by observing clinical response of levodopa. So improvement after administration supports dopaminergic deficiency as a root cause. The next is a trending investigation in Parkinson's disease globally, gut microbiome test. This is an emerging game changer in nowadays. Recent research reveals a strong gut-brain connection in Parkinson's disease. So imbalance in gut microbiota, that is dysbiosis, can precede motor symptoms and contribute to inflammation and neurodegeneration. This test analyzes the diversity and health of a gut bacteria, helping personalized diet, probiotics, and herbal interventions in Ayurvedic care, making it cutting-edge tool in early detection and holistic disease management. Excuse me. And always be alert about digestion, samyak agni maintenance, proper metabolism. What is metabolism? The food what we have to take should be digested properly, absorbed properly, and converted into energy, and the rest of the things should be excreted. Next is Patya Ahara. Ensure proper nutrition, sattvic diet. Ensure proper hydration. Samyak Suganidra, at least 8 hours of sleep in a well-ventilated room in the nighttime, not in the daytime. A constipated bowel is never acceptable.
Doctor, your microphone is off. Can you please put it on?
I'm sorry for the interruption. So we can continue. So next, the most important part in the treatment of Parkinson's disease, differential diagnosis in Parkinson's disease. Differential diagnosis involves distinguishing Parkinson's disease from other conditions that present with similar motor symptoms, such as tremor, stiffness, and slow movements. Accurate identification help us rule out other neurodegenerative disorders like Parkinsonism, atypical Parkinsonism, Alzheimer's, PSP, dystonia, multiple system atrophy, motor neuron disorders, amyotrophic lateral sclerosis, cerebral and cerebellar ataxias, OPCA, oligopontocerebellar ataxia, dementia, chorea, tics, writer's cramp, then cervical dystonia, different types of dystonias, etc. So, a tailored treatment. Each condition responds differently to medications and therapies. So, a correct diagnosis ensures patients receive the most effective and the least harmful treatments. Prognosis and planning. Non-Parkinson's disease disorders often have faster progression or different symptoms. So early differentiation helps in planning long-term care and support. Avoid misdiagnosis. Prevents unnecessary treatments, medication side effects, and psychological stress from being wrongly labeled as Parkinson's disease. Just look at the screen. I'm having a comparison between cervical myelopathy, which is purely a spinal disorder, and Parkinson's disease, which is a neurological disorder. So let us see the similarity of the symptoms. So the gait difficulty is the gait difficulty is both seen in cervical and Parkinson's disease. Hand clumsiness is seen in both conditions. Muscle stiffness is seen in both conditions. Tremors is very rarely seen in cervical myelopathy and very common in Parkinson's disease. Sensory symptoms like numbness and tingling is present in cervical myelopathy, but very rare in Parkinson's disease. Postural issues is seen in both the conditions, and non-motor symptoms like sleep or mood will not be seen in cervical myelopathy, but in Parkinson's disease. So let us see, 80% of the signs and symptoms in cervical myelopathy and Parkinson's disease are the same. So there are chances of misdiagnosis. So differential diagnosis, maximum investigations, try to consult a doctor, take a second or third opinion before starting the medication, because this is a chronic disorder. Once you start the this conventional medicines, it is very difficult to cut down the dosage or stop the dosages. So you have to meet one or other system of medicine and one or two or three doctors to get a second or even a third opinion. And coming to the diagnosis, I had mentioned that TRAP, 4 cardinal symptoms in Parkinson's disease. So if the patient is seeing at least 3 cardinal symptoms, then we can confirm that that patient is having a typical Parkinson's disease. See, once we diagnose the condition, then what we have to do, we have to define a treatment protocol. So the treatment protocol is individualized as per the condition and nature of the patient and the progression of the disease. So generally, I advise the patients to go in 3 stages, that is Shamanam, Shodhanam, and Rasayanam, which includes internal medicines, external therapies, and allied healthcare techniques. So Shamana means symptom management and stabilization. So this Shamana stage aims to pacify the aggravated doshas using herbal medicines, diet, lifestyle changes, and supportive therapies without removing the root cause immediately. The second is the most important stage, that is Shodhana, that is cleansing or detoxification therapy, we are doing Ayurvedic Panchakarmas in this stage. So the process of eliminating accumulated toxins and aggravated doshas through Panchakarma procedures to restore the balance and root level healing. And during this Shodhana therapy, our unique treatment protocol will be integrated along with this Ayurveda Panchakarma. I had mentioned our unique treatment protocol includes physiotherapy, then yoga, dietetics. That it is coming in the coming slides. And the third stage is Rasayana, that is the regeneration therapy. So this regeneration therapy focuses on strengthening immunity, restoring vitality, and preventing recurrence by using regenerating herbs, toxins, and lifestyle practices. Internal medicines, external therapies, allied health care techniques. So these internal medicines includes Ayurvedic decoctions, herbal medicated oils, then herbal ghees, then herbal powders, tablets, different types of medicines are available. These are all aimed at improving nerve and muscle strength, cognitive ability, as well as regeneration of atrophied cells. The external therapies, that is the Panchakarma therapies, meant for the purification and rejuvenation. So Panchakarma therapy will help to improve muscle strength, tone, and bulk, as well as improving cognitive and sensory functions. Integration of allied healthcare techniques, I had already mentioned, that is incorporated with this Ayurvedic treatment. Now, introducing Mydopa. This is an exclusive blend of precious herbs meticulously formulated based on Ayurvedic wisdom. So it provides natural L-DOPA while stimulating dopamine production in the brain, offering a dual benefit for individuals with Parkinson's disease and other progressive neurodegenerative diseases. This safe and effective herbal supplement supports symptom management and enhances overall quality of life. The major ingredients or the ingredients in this product is Kapikachu, that is, we all know Macuna purulens, where there is a herb globally which contains maximum natural source of levodopa. Then Ashwagandha, Withania somnifera, then Haridagi, Terminalia chebula, then Vipidagi, Terminalia bellarica, and Amalagi, that is Embolica officinalis. And the cow milk. Cow milk is we are processing these products in the cow milk. So, Mydopa is a complete herbal health supplement for the people with Parkinson's disease and other progressive neurodegenerative diseases. The key ingredients in Mydopa are the natural source of L-DOPA, approximately 200 milligram per sachet. Mydopa promotes overall brain health, protects healthy brain cells, and repairs degenerated brain cells. Mydopa promotes natural dopamine production, and this Mydopa arrests further degeneration of the brain cells. The mechanism of action of Mydopa is L-DOPA from Macuna purulens as precursor to dopamine, Withania somnifera for neuroprotection, and Triphala for gut health. This is the mechanism of action of Mydopa. So, this controls tremors and improves motor function. This is very healthy and active life with Parkinson's disease patients, a natural alternative to artificial dopaminergic medicines, natural source of levodopa, arrests degeneration of brain cells. It's a good aphrodisiac and supports cognitive health and gut health. The key features of this product are these are standardized herbal extracts for precise dosage. 100% natural and plant-based ingredients. This product is free from synthetic additives, preservatives, chemicals, added colors, added flavors, or anything. This is purely herbal and plant-based. Nothing is added in this product. And the direction for the use is dissolve the contents of one sachet in a half glass, that is approximately 90 ml of lukewarm water, or a homogeneous mixture, or you can mix it with your green tea, or you can mix it with tea, coffee, any solutions, and stir well continuously to ensure it blends perfectly, and drink immediately for best result. And one thing, there will not be any sediment. 100% it will dissolve in that liquid, whatever you're adding. And each sachet is carefully packed to deliver precise dosage and ensure utmost convenience for each time usage. So, the Vyam's unique treatment protocol. You can visit www.mydopa.com for more details. So, Vyam's unique treatment protocol, an integrated treatment approach to neurodegeneration. I had mentioned that customized Ayurvedic medicines, Panchakarma therapy, integrated with physiotherapy, yoga is there. So, I had mentioned about customized Ayurvedic medicines, Panchakarma, and everything. Now, I am going to mention about the importance of and the role of the allied healthcare sciences. So, the integration of physiotherapy. So, regular physical exercise can be beneficial to maintain and improve mobility, flexibility, strength, gait, and quality of life. So, physiotherapy can help with movement and balance problems. That includes aerobic exercises, balance training, gait training, flexibility training, and visual tracking. Integration of clinical psychology. So, our psychologist assesses individuals to diagnose their cognitive, emotional, and behavioral disorders and treat using a variety of techniques, including cognitive behavioral therapy. They support the patient as well as their relatives. It's a three-tier setup: the patient, the caregiver, the family members. So the first therapy they're giving is cognitive behavioral therapy. That is CBT, focuses on identifying the challenging negative thought patterns and replacing them with healthier, more positive ones. Next is mindfulness based approaches. Incorporate mindfulness, meditation, and techniques to increase awareness of the thoughts, feelings, and bodily sensations without judgment. And behavioral therapy, solution focused therapy, family therapy, group therapy, art therapy, these are all providing from the clinical psychologist. Coming to the ASLP, audiologist and speech language pathologist. Their role is the ASLP specialist assesses, diagnose, and treat speech, language, social communication, and cognitive communication. Swallowing difficulties, dysphagia, hearing and imbalance problems, vertigo, using the assistive communication devices, and change the food consistency to correct with the following difficulties mentioned earlier. Because if the food get into the lung, that causes aspirational pneumonia. So the ASLP specialist helps to prevent this from happening. Next is the integration of nutrition and dietetics. We have observed that the absorption issues can be resolved with the help of a nutritionist. So the dietitian assesses a Parkinson's disease patient's food and nutrient intake, their lifestyle, and medical history. Their advice can contribute to the improvement of Parkinson's disease symptoms and increase health-related quality of life. Planning of balanced diet based on periodical nutritional assessments is essential because Parkinson's disease patients present with gastrointestinal dysfunction leading to constipation and gastroparesis. That is, food remaining in the stomach for a longer period than normal. Diet planning is also needed to maintain nutritional levels by avoiding weight loss or even weight gain. Next is integration of yoga and meditation. Yoga is the science gifted to the world by primordial Indian culture. Yoga aims to unify body and mind by combining respirational and physical exercises. Yoga enhances body movements, cognitive behavioral problems more than being a mere exercise regimen. Yoga aims to coordinate bodily functions with that of the mind. Various yoga techniques helps in maintaining peace, confidence, and happiness to the mind while helping to increase flexibility, reduce muscle spasms, and ultimately leading to an improved quality of life. Each soul is potentially divine. The goal is to manifest divinity within by controlling nature, external and internal. Do it either by work or worship, psychic control or philosophy, by one or more or of these, and to be free. The systemic methodology of unfoldment in this inner potential divinity by moving towards self-perfection is referred to as yoga. A yoga session mainly comprises of breathing exercises, meditation, and yogasana that stretch and strengthen various muscle groups. The benefits of yoga includes flexibility of muscles, corrects the posture and alignment of the body, renders better digestive system, strengthens internal organs, helps in skin glow, promotes strength and stamina, improves concentration, helps in mind and thoughtful control, keeps mind calm by overcoming anxiety, stress, and depression. Also helps in releasing mental tension. This yoga helps in blood circulation and muscle relaxation. Now we are coming to the uh, conclusion of this webinar, the mitigation and management VIAMS method, alleviation of exaggerated doshas with customized internal medications or formulations, and clearing the body with panchakarma therapies. That means complete purification and removal of toxin substances, all from all of the dhatus, that is the body tissues, improving the core muscular functioning and imbalance through physiotherapy. Psychology counseling assesses and treats emotional, cognitive, and behavioral problems. ASLP specialist assesses and treats person's speech, language, and hearing problems. Rekindling the vigor of the body and mind through yoga and meditation. Conclusion: Parkinson's disease is a disorder with no established cure. Ayurveda has shown that it has a better success rate than other systems of medicine when dealing with any degenerative disorders. Similarly, its considerable potential in dealing with neurodegenerative disorders is yet to be properly tapped. Parkinson's disease does not affect the lifespan of the patient, but it affects the quality of the life. Parkinson's disease family members give extra help and support to stay and preserve their quality of life. At VIAMS, we aim to properly treat and document each of these cases with ultimate aim of bringing Ayurveda into mainstream medical discussions. Yes, we can control Parkinson's disease. Thank you. Thank you very much.
Thank you. Thank you, Dr. Vijit, for sharing your knowledge and expertise with us. Now we have reached the Q&A portion. Dr. Vijit is ready to address your questions.
Okay, I hope I'm not audible, right? I'm just stopping the screen share. Yeah. So Zoom user, direct message, sir, will person be habitual of it or not as IDOPA becomes like that and the body becomes habitual for it? Can it act as a catalyst for inducing dopamine? Mr. Zoom user, can you please unmute and ask what is exactly what you're asking?
So means I have a question that it can induce habitual
It or not as
मतलब like आदत पड़ जाती है सर देखने में
and the body becomes inverted. Can it act as a catalyst for inducing dopamine? Mr. Zoom user, can you please unmute and ask what is exactly what you're asking?
So means I have a question that it can induce habitual
As
like आदत पड़ जाती है सब देखने में.
and the body becomes inverted. Can it act as a catalyst for inducing dopamine? Mr. Zoom user, can you please ask what is exactly what you're
So
asking?
first of all, I would like to tell you.
I have a question that it can induce
So first of all, like I would like to introduce myself. That I am Nirdesh Kumar and 44 years of age, and I am suffering from this PD. Sir, your
Yeah,
voice.
go ahead, go ahead.
Ah, yes, sir. I am suffering. I was suffering from PD since 2018 and diagnosed in 19, and took medicine from your hospital also through our video chat. So you are not audible, sir.
Go ahead, go ahead.
Dear Zoom user, you
Yes,
had
I'm suffering. I was suffering from PD since 2018 and diagnosed in 19, and took medicine from your hospital also through our video chat.
your
Okay.
good name?
So you are not audible. Nirdesh Kumar, sir. Nirdesh Kumar.
Go ahead, go ahead. Dear Zoom user, you had
I'm suffering. I was suffering from PD since 2018 and diagnosed in 19, and took medicine from your hospital also. Video chat.
your good name?
So you are not audible. Nirdesh Kumar, sir. Nirdesh Kumar.
Hello.
Yes, sir.
Yeah, you have multiple logins, so the sound was very disturbing.
No, sir. I'm alone, sir. I have logged in
No,
my from my.
you had multiple logins. Now it is clear. One of your account has been removed. Now it's clear. Okay, please
Oh.
ask. So what you're trying to say is you had consulted me over video consultation and you are taking
Yes.
medicines from my side.
Just when you told me that Panchkarma. No, sir. I'm alone, sir. I have logged in my from my. Okay.
You had multiple logins. Now it is clear. One of your account has been removed. Now it's clear. Okay, please ask. So what you're trying to say is you had consulted me over video consultation and you are taking
Yes.
medicines from my side.
Just when you told me that Panchkarma. Shall I log out, sir? I have logged in my from my game.
Now it is clear. One of your account has been removed. Now it's clear. So what you're trying to say is you had consulted me over from my side.
Just when you Panchkarma. Shall I log out, sir? I have logged in my from my game.
I have put a question
Shall I
in
log?
the chat box.
I think you log off and rejoin. It may help, but it may be better. Try.
Yeah, I'm trying to fix it, but
Sir, I have logged out and again logged in.
You log off and rejoin. It may help, but it may be better. Try.
Yes, sir. I have logged out and again.
yeah, I'm trying to fix it, but
Sir, I have logged out and again logged in. ठीक है
Hello.
Sangeeta, give me a moment. I'm trying to fix this sound problem. Give me a moment.
Okay.
Sit idly. I think the problem has been resolved. Am I audible to you? Am I audible?
Yes, doctor.